Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
To another segment of Your Health Matters here on Kaieteur Radio. I'm your host Rihanna Ramsey, and today we will be discussing World Population Day, which is an event observed on July 11th every year to raise awareness on various population issues. According to the United Nations, World Population Day highlights the problems of overpopulation and raises awareness about the effects of overpopulation on environment and development. According to the United Nations, it took hundreds of thousands of years for the world population to grow to 1 billion, and then just in another 200 years or so it grew sevenfold. In 2011, the global population reached its 7 billion mark, and today it's about 7.7 billion. It's expected to grow to around 8.5 billion by 2030 and 9.7 billion in 2050. World Population Day was observed under the theme Rights and Choices Are the Answer, Whether Baby Boom or Bust. The solution to shift in prioritizing the reproductive health rights of all people. Today we have with us 3 doctors who will be sharing on the 3 main factors that relate to the population growth. Dr. Umade Ratan, Dr. Tamika Lunshan, and Dr. Monique Williams, all of whom are attached to the Women's Health Unit at the Ministry of Health. Good afternoon, doctors.
Good afternoon.
Yes.
Good afternoon.
Hello. Oh, you're joining. I should mention they're joining us virtually because we are in the pandemic still, and we're trying to stay socially distant and practice the guidelines. So, Dr. Ratan, this is your first time with us on Kaieteur Radio, and for those who don't know who you are, I'd just like you to just tell them a bit of what you do and a little bit about yourself.
Okay, well, thank you for having me. My name is Umade Ratan, and I'm the coordinator for women's health at the Ministry of Health.
Mm-hmm.
Basically promoting women's health, ensuring quality service for women throughout the country. That's basically what we do. It's just what we do in a sentence, but it's a lot more than that.
I know.
Reality.
So we're discussing, for those just tuning in, we're discussing World Population Day, and before I got started, I gave a bit of rundown about what World Population Day is. Dr. Ratan was one of the persons who was at the forefront raising awareness about some of the issues related to World Population Day. Yesterday, it's observed every July 11th, every year, and she'll be talking to us about the 3 main, she along with her colleagues, Dr. Monique Williams and Dr. Tamika Lunshan, they'll be sharing with us on 3 subtopics, which is sexual and reproductive health, family planning, and infertility. And so our first subtopic would be sexual and reproductive health. And one of the questions that I have here is, for those who don't understand what that is, could you break it down for them? And why is it important? Tell them why that's important.
So sexual and reproductive health, it's a very simple concept to understand. It is basically, it's health when it relates to your sexual well-being, meaning that it's your choice and your decision when you desire to start a family, having a safe sex life, and to ensure that you have good habits that don't lead towards any disease of your reproductive system, whether we're talking about sexually transmitted diseases versus cancers of the reproductive system, and basically ensuring that you have access to services and education and information to promote those things, and making sure that these services are for each and every single one of us. There's no discrimination as to the way you identify as your gender, that there's no discrimination against age, or no discrimination against any Guyanese citizen. It's a service and it's a basic human right of every citizen in every country of the world, to be quite frank.
So that's Dr. Launchen speaking?
Yes, that was me.
Dr. Launchen, in terms of, we know Guyana had implemented or launched a strategy, a policy, a sexual and reproductive health policy. Could you tell us what's our status in terms of that implementation?
So in safeguarding this very important mandate of the ministry, the Ministry of Health actually, as you mentioned, has a sexual and reproductive health policy. This is our guidance document, and it is for our standardized care, and it speaks towards having access to sexual and reproductive health services, which goes from the range of disease prevention, STI prevention, chronic cancers of the reproductive system, as well as offering contraceptive or family planning to all the different persons in Guyana. And I know most people will think when I say family planning, I'm just speaking about females, but I'm talking about family planning for a couple, because not all family planning methods are specific to the female.
Right.
So we actually do have a lot of implementation when it comes to this policy. We do quite a lot of training to ensure that there's equitable services throughout the entirety of Guyana. We train healthcare workers on counseling, how to choose good forms of family planning, how to do the examinations and different lab tests to ensure that each and every single Guyanese has at their disposal these services. And also not just us working in that way, but also being able to provide education or information to persons, because it's not just doing a service, it's also providing persons with evidence-based information so that they themselves can make an informed decision.
How early should persons understand or be aware of the importance of their sexual and reproductive health? Does it start as a primary school age? Does it start at adolescence? What age?
So this is an excellent question, because a lot of persons will say, oh, till they're big, then you should start talking about these kinds this topic. And to be quite honest, that's not the right way to go about it. From the time children start to have an understanding, you should start the education forum for them. You will obviously give them knowledge based on their age. So for a little child, you won't tell them about contraceptives, but you should start with having them identify their body parts, recognizing who is safe to take care of them and what is allowed. And as the child grows, the knowledge and education that you provide to them should increase, so that by the time they're a young teenager, they would already be familiar and you're not overwhelming them. You're supposed to start this conversation from very young. And I'm not saying overwhelm them with the information, but as they grow, you will know how much of that information you should provide to them.
In terms of the methods that we have here in Guyana, how advanced are we as it relates to safeguarding our population's sexual and reproductive health?
Pardon, I didn't get that.
I was asking in terms of the advancement of the services, the sexual and reproductive health services in Guyana. How advanced are we in terms of safeguarding our population, in terms of the methods and the services that we provide?
Also, we have all of the different family planning services that are available throughout the country. Persons may ask what happens in terms of our hinterland. We do have services available in all of the regions. We do even have what we call mobile family planning clinic, where a service may not be all year round, but we do go out and capture those populations periodically, like at least once a quarter. We try to go out and ensure that even if the service isn't available all year round, that we do capture the existing populations in the hard to reach or far flung areas.
In terms of protection, we have largely promoted the use of condoms and contraceptives and some more known methods. What are some lesser known methods that are safe and effective as well?
So in terms of contraceptive or in terms of STI?
STI, sorry, I'm sorry. I'm so sorry.
So the only method that we have for STI protection is the condom. It's the only dual method contraceptive that exists in the world. So even if you do have some other form of contraceptive, let's say an intrauterine device, or what we call the 5 or 10 year or the copper T, you should, if you don't have a stable partner and you are at risk for having exposure to sexually transmitted diseases, we will still tell you to use a condom, because other than not having sex, there is no way to safeguard or to prevent sexually transmitted infections other than the condom. All the other forms of family planning are specifically targeted towards preventing pregnancy and not the transmission of sexually transmitted diseases.
So I noticed we're talking about sexual and reproductive health, but we're also talking about family planning as well, because the two are interlinked, right?
Yes, that is one of the basic foundations of sexual and reproductive health, ensuring that you have access to contraceptive care or family planning, and deciding if you don't ever want to have, and ensuring that you have a safe and, and that is your choice, basically.
I get you. So family planning now, what's the difference? I mean, there's probably a slight difference between sexual and reproductive health and family planning. What is can you give like the differentiation there?
Okay, so family planning, we talk about family planning as it relates to spacing of our children, when we want to have children, if not we want to have children. That's basically what family planning is. However, sexual and reproductive health, family planning is a part of sexual and reproductive health. But sexual and reproductive health, or SRH services, goes beyond that. That's the whole umbrella that family planning comes under, and it includes violence against women, like gender-based violence, the different cancers, in other countries, we have genital mutilation, child marriages, safe motherhood. All of those things come under sexual and reproductive health. But family planning is just like one pillar of that whole umbrella.
Thank you, Dr. Rattan. So we have 3 doctors here with us. They're joining us virtually. If you're joining on Facebook, you might not be able to see them because of the connection, but you can hear them on the radio. It's Dr. Umaday Rattan, Dr. Monique Williams, and Dr. Tamika Luncheon. They're all doctors attached to the Women's Health Unit at the Ministry of Health, and they're sharing with us on the importance of these 3 issues, which is family planning, infertility, and sexual and reproductive health all under the topic of World Population Day, which was observed yesterday. And so we'll take a short break, and when we come back, we'll have a little bit more on our discussion about family planning.
COVID-19 testing sites in Region 4, Sunday to Saturday, 9 a.m. to 2 p.m. at Herstelling, Paradise, and Umanayana. All COVID-19 protocols must be observed. You need a COVID-19 test if you are a close contact of someone who tested positive for COVID-19 and if you are showing symptoms of COVID-19. A message from the Ministry of Health.
Welcome back to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and I have with me today Dr. Umade Ratan, Dr. Tamika Luncheon, and Dr. Monique Williams, who are all attached to the Women's Health Unit of the Ministry of Health, and they're talking to me on the issue of the topic of World Population Day, and we're sharing on the subtopics of sexual and reproductive health, family planning, and infertility. We were just talking about family planning when we went to a break, and so Dr. Ratan? Hello?
Yes, I'm here.
So Dr. Ratan, could you share with our viewers and listeners the importance of family planning and why and whether more Guyanese are becoming more aware of the benefits of this outlet?
Well, no problem. Family planning is important to different persons for different reasons. Of course, whatever your reason is for family planning might not be mine.
Mm-hmm.
So the importance of family planning in the health setting is because of the spacing of pregnancies. We try to encourage at least 2 years between each pregnancy. Of course, if a woman comes before, we're not going to say, you can't be pregnant. But if in terms of safe planning, and so we try to encourage safe motherhood, which describes 2 years
Mm-hmm.
between each pregnancy, and that helps us for safe motherhood, good health to the mom, lessen the chance of anemia or low blood count in pregnancy, healthy baby, healthy pregnancy. So 1, the spacing. 2, for economic reasons, family planning is important because maybe you want to delay the pregnancy because you can't afford it right now. Maybe for education reasons, you want to study, you want to complete university first. And also maybe for health reasons, that's also okay.
Mm-hmm.
Sometimes you have something going on and you just need to fix that first, get yourself ready first, and then
Mm-hmm.
and of course, if we're talking about our teenage population, we would like to delay the pregnancies as long as possible because your body needs to be ready. You need to be while the reproductive age and the legal age, we all know that. But we're also trying to delay it, encouraging you to get pregnant at a later age because in teenage pregnancy is a high risk pregnancy
Mm-hmm.
for worldwide. So we're trying to prevent that. And also people use family planning just because they don't want to get pregnant for not a specific reason, but they just don't want to get pregnant. There are those women that just don't want kids, and that's also okay.
Mm-hmm. So in terms of are Guyanese utilizing the service more? Are they benefiting from family planning more? Given it's, Hello?
Well, what I could say is that all the family planning options are available, and they're available right now. Maybe what we have available now is definitely more than what maybe 10 years ago. So, and women are becoming more aware of the services. For history and gone by, women always use different kind of birth control, family planning, or whatever. But now we have different options. We're doing a lot of community education as well as a lot of training with our healthcare providers to ensure quality service throughout for all the centers. And I think with all of these promotions, sensitizations, women are also becoming more aware of their options at the different levels. So they know when they go to ask for different options. They're not just condemned to use it, maybe only the pill or maybe only the injection or maybe only condoms. All the options are available for women throughout our country, and that by itself says a lot that there's a need. That's why we had to provide it. So that alone says that more and more women are reaching out for these services.
Okay. In terms of birth control, what are some of the most common or most effective methods here available to us here? And are men, is there anything that they can do? Because I think I read recently that they were trying to get men on board, some form of birth control as well. Not birth control, but something to help them in that aspect.
Yeah. Mm-hmm. So we have different, as Dr. Atman would have said, we have quite a few different methods that, and surprising as this may sound, that are available in our public healthcare system for free.
Mm-hmm.
We do have temporary methods and we have permanent methods. Among our temporary methods, we have whether they are hormonal or non-hormonal. Under the hormonal, meaning that they have some form of hormone in them, usually either progesterone or estrogen, the synthetic forms of them. They can have one of those or they can have both. And under those, we have the oral contraceptive pills, or the ones that the woman will use one pill a day. They have the 21-day packs and the 28-day packs. We also have the injection, as the women will call it, the 3-month injection. We also have the 2-month one. We also have an implant, which is one of the newer forms of family planning that quite a few of our women are accessing now. It's like a small little matchstick rod. It's about the size of a matchstick, and we insert it in a minimally invasive procedure into the upper arm of the young woman. And then under our non-hormonal forms, we have what everybody refers to as the 5 or 10 year copper T, which is called by the medical name is the intrauterine device. We also have under our, as we would have mentioned, the condom is the only one that offers the dual protection. So it protects against sexually transmitted infections as well as it prevents pregnancy. All of the methods that are increased form of effective if you don't use them well. For the methods like our 5-year, 10-year, or implants, and so those are very effective method. Implant is actually about 99% effective. It's one of the best methods that we have available into our country, and it can last, depending on which one you have, for either 4 years or possibly 5 years, depending on the one that you have. We have for permanent family planning, for women or couples that have decided they've reached their quota and they don't want any more children, or even if they haven't had any children. For the women, they can do a tie-off. That's a very known one. It's an irreversible procedure. I wouldn't go into what the men can do. Dr. Atan can take that question.
Okay, thanks, Dr. Lunchan. So as you were talking about the men's involvement, so we are trying to encourage not only the women to go to clinics alone. We want the men to accompany them, or whoever is your partner, to accompany you to clinic. So that also promotes safe sexual practices. So one of the things that men can do, one, is go into clinic when they're discussing it. So we don't have, it's not called woman planning, it's actually called family planning.
Yes.
So we want that term to get more out there and to understand. So one, the condoms, that's an option. And the other thing is, just like there's the tie-off for women, or the permanent stop, the cut, however you want to call it, there's also that option for men. And I think we could count on our hands, on our fingers, how many cases we have every year. Barely anything. So, with more counseling and more awareness, that's one way that men could help, because it's not family planning should not only be left, for the women to bear that burden. it should be a shared responsibility, and that's one way that men could help. And there are some women that cannot use any hormonal, that cannot use certain contraceptives. Now, if that's the case, that's also a time for the men to step up and participate. So, and it's actually, you don't need to even stay in the hospital. It's a day case or clinic office procedure that they could go home the same just after it's done. Now, for all the methods that Dr. Luncheon mentioned, it's interesting because not everybody can use every method. Everybody's body is different. So it's not that it can't work, but what's best for you might not be what's best for me.
Yes, I get you.
So, yeah. So what we do is, it's simple, like a pressure tablet. If you got high blood pressure, you might be using one blood pressure tablet.
You don't go and give your neighbor the tablet because their pressure is high.
So it's something like that. We want to make sure that persons do. This is healthcare. Women's health is healthcare. So just like you ensure you go to the doctor, you ensure you get your checkup before you use a medication, it's the same exact thing with contraceptives and family planning. Before you get a method, there's a criteria that you're actually supposed to meet. You're supposed to get a history taken, get a physical, and make sure that method is best for you. You work with your doctor, and that's decided upon, and that process is called informed decision making. And we check your medical eligibility criteria to make sure that method is what's best for you, that it wouldn't cause you any harm, it wouldn't interact with any other illnesses that you might have. If you have something as simple as a migraine or frequent headaches, for example, pills are really not the best option for you. And so simple things like that. If you're tested, if you have uncontrolled high blood pressure, and different things like that. So family planning is not something that should be taken lightly. It's not something that you should just go and get over the counter at the pharmacies, as much as that's a practice that's happening. It's really not something that should be happening, because you could have other conditions and other health issues happening that could interact with these medications that you're putting into your body.
It is a process.
Well, thanks for telling us that, because my next question would relate to persons who are using, there have been reports of like abuse of these emergency contraceptive. What can you say to persons who are misusing it, or persons who might not even know that they're misusing the emergency contraceptives? What can you say to them to help them get on the right track? I know that you just mentioned that it's an entire process and it's free and all of that, but what can you tell them? What else can you tell them in terms of that issue?
So first of all, the name tells us something. It says emergency contraceptive. The name says that it's to be used in the case of an emergency. Emergency would be defined in this kind of terms for persons who would have had a rape or a penetrative sex on where they don't agree. Those are persons who can get who can use emergency contraceptive. And also in the case of a failed family planning, meaning like if you normally use condoms and the condoms broke, or if you use pills and you forgot to take your medication, and it's something that the name tells you an emergency doesn't happen every 2 days, or it happens this week and next week. An emergency happens when it's an abnormal situation, it's out of the ordinary. So the message we want to put out there is that persons should avoid. If you know that you've been using emergency contraceptives every week or every 2 weeks, you're at the pharmacy buying a pill, we'll come back to the pharmacist. You're buying a pill, what you should do is go to a healthcare provider and ask them to put you on a regular form of contraception. And it's very simple. We've mentioned the many options that we do have available, and along with your healthcare worker, you can make an informed decision. But this burden is not just a patient's burden. It also goes for the pharmacist, because these persons are going there and they are purchasing it. And I'm not throwing blame on the pharmacist, but they should also advise their the persons who are accessing the service to go to a healthcare provider and choose a form of regular family planning or regular contraceptive. They also have their role to play. They shouldn't be selling individual a box of emergency contraceptive. It's a little unethical, to be honest. But they should also inform them that dosing their bodies with these high level of hormones, which is what the emergency contraceptive does, creates many problems for the patient. They end up with abnormal bleeding, they end up with irregular cycles, a lot of things. They gain weight, all kinds of problems. They basically throw their hormones out of whack when it's misused.
All right, we'll take another break, and when we come back, we'll talk about infertility.
Thank you.
The COVID-19 vaccine gives us hope for a healthier tomorrow. Have you received your shot yet? The Regional Health Services in Region 2 invite you to get vaxxed and get a chance to receive a COVAX hamper. A what? A COVAX hamper. When vaccinated, you will receive a coupon, and drawings will be done weekly at the Study Health Center and broadcast live on the Regional Health Services Facebook page on Sundays. Get vaccinated and get a chance to be one of 4 lucky winners of a COVAX hamper. Pomeroon Supernam, fighting COVID-19 for a safer region and safer Guyana.
Welcome back to Your Health Matters with me, your host, Rihanna Ramsey, here on Kaieteur Radio. And we're talking to Dr. Umaday Rattan and Dr. Tamika Lonchan. They're joining us on the occasion, well, yesterday we celebrated World Population Day, and we just are using the opportunity to raise awareness about sexual and reproductive health, family planning, and infertility, which are 3 main issues related to a growing population or health issues. Dr. Rattan? Hello?
Yes, I'm here.
Okay, so I think this is your area. Infertility, we're looking at the subtopic of infertility, and I noticed in the recent years our rate of infertility among the rate of infertility among Guyanese has become more common. Is there a reason for this?
We don't have that stat to share with you, but what has happened is not necessarily that it's more common, it's that there's more awareness. Okay. So persons know that where to seek care. So, sometimes people married for a long time, they're condemned, if they can't get children, they're called barren. And people, I mean, mostly the women are being targeted, not necessarily the men. And they're being called barren, they can't get kids, all sorts of things. And then even us as their friends, we can say, as soon as somebody marry, what happened? You don't get insurance. 2 years done past, you make comments when you're going for the next one. And those are, that's something I actually wanted to touch on, as we actually touched on it early. That's very insensitive, and that's discrimination. And we're trying to move away from that culture to break that away, because you do not know what a couple is going through, what a woman is going through. And some women have many consults with doctors, and they spend a lot of money. They do all sorts of things to try to get pregnant, and it doesn't happen. And it's psychological. So maybe next time we want to make a joke with our friends about when you're going for the next one, or when this baby coming, let's take a step back and try to think maybe they're going through something, and we should be sensitive about it.
I've noticed a lot of, because you said it's now being basically uncovered. It's not that it wasn't happening. A lot of clinics there are several clinics offering several services to address the issues of infertility. What are some recommended methods of dealing with it?
Okay, well, before we decide to treat infertility, we have to find out like what the causes of infertility are, and we would usually we separate them because it could be men and women. So like 33% of the cause of infertility is actually some cause of the woman, like the woman's issues. 33% is actually the man's issue, and the other 33, it's actually divided into like both of them have an issue or it's unknown, like we just don't know. All the tests normal, everything fine, but they're just not getting pregnant. They're probably just not compatible together. So what we do what happens if somebody has regular sexual intercourse in at least 3 to 4 times a week, if they have their regular period, and maybe about a year after they would have had this, they would have been trying, we would then put them under the umbrella of infertility, and then we would start the workup. So it's not like if you start having sexual intercourse in a month and you don't get pregnant, we label you as infertile. So it's not that. So infertility, there are different causes, like for example, for the women and men too, sexual transmitted infections. So unsafe sexual practices could lead to repeated infections, especially like gonorrhea, and those things do potentially cause infertility, especially in women. So that's one. You could have blocked tubes for some reason. That's one. So for that, as I could tell you some of the things we do to find that out. You could have like blocked tubes, for example, and for that we have to do like an internal X-ray to check to see if the tubes are blocked. You could have other issues like hormonal issues. We have to do blood tests to make sure that you are producing eggs. If you're not, well, then we would have to give you treatment for that. Now for the men, you could have, you know how you have like varicose veins on your legs and so on?
Yes.
Actually, the men could have that like on their scrotum. They could have varicose veins there. Now with varicose veins, it means you have more blood supply, which means it's warmer, which the sperms can't really survive in that environment when it's too warm. That could be a cause for men. Another thing could be their jobs. Now, some men work in certain jobs when there's a lot of heat, and that could also affect their sperm count and so on. Their clothing, that could also affect it. And they also have the men could also have low hormone level, low testosterone, and that could lower their sperm count. So for the couple, not when a woman comes, or if the couple comes, we just say, oh, the woman, they ain't getting children, we treat the woman. We don't do that. We make sure we do blood tests to check if they're producing eggs. If their tubes are blocked for the women, we do a sperm test for the man to make sure he's producing the right amount. He is producing, if he needs treatment, and then we move on from there. But those are the basic things we do before we go on to do further investigations.
It's known that these kinds of treatment can be quite costly. Is there a way in our country that we can access them at a reasonable cost, or a price that that the ordinary man could afford?
Well, it's just like any other service in the healthcare system. You know, our healthcare system is divided into public, private.
Yes.
And you choose to go private if you choose to go private. But they're actually available in the public system at the main hospitals. They're actually available where we have the specialists, the gynecologists, the OBGYNs. They are available there, and they come for the consults, and depends on what the need is for that couple.
Hello? She's gone. Dr. Ratan?
Yes, I'm here. I was saying they are available in the public health system.
Okay. We know there are some people who believe in just using natural treatments and so on. Are there natural supplements that can increase your fertility rate that we can use?
So natural remedies for infertility. That's what you're asking?
Yes, that's what I was asking.
Okay. Well, I mean, people might have seen the results, but I really can't comment on that. I don't really.
No, I'm talking about like using
experience.
any supplement, not just the natural remedies in terms of using any supplement that could boost your your hormone count or whatever it is that you need to increase your fertility rate. Are there things that you can use from the pharmacy or so?
Actually, there's not anything that we would recommend to you for that. But as I said, each woman or each man, each person, before we offer treatment, it really depends on the cause of the infertility. So it's not like a one cap fit all kind of situation. It really depends on what the issue is. However, we should mention that there are high-risk pregnancies and difficulties with conceiving, and this could include, as I said, STIs. It could include that sexually transmitted infection, advanced age. Right now, according to the definition of advanced maternal age or paternal, but it really talks to women, is 5 years and above. It doesn't say you cannot get pregnant. That alone by itself reduces. By time 40, your chances drop. By time 45, your chances drop even further. So age alone, that's also a factor. Now, generally, fibroids, that's not a factor. However, there's a but to that. It depends on the size, and it depends on the location, and it depends on if it's so big it's causing like the womb to change its size and so on. But generally, fibroids alone, it's not a problem. But it depends. It does have a but to that, like a subscription to that. However, generally, there is under our program, it's the Safe Motherhood Initiative and preconception and that part. This is for any woman who is planning to become pregnant. What we would recommend is for you to start using your folic acid if you're in the reproductive age, and if you're planning a pregnancy, to start using at least your folic acid and your vitamins. But that's one thing that we recommend, because the folic acid is really important, at least for the first 4 to 6 weeks of the baby developing. And a lot of times when you find out you're pregnant, you actually already passed 6 weeks. You done pass a month. You done. So if you know that you're planning a pregnancy, that's the only thing that I would actually recommend, the use of folic acid. And that's the reason why. It's not that it increases your chance of getting pregnant. It prepares your body so that if you do get pregnant, in that window, it's already working. It's already doing its function for at least the first 4 to 6 weeks of pregnancy, of developing.
All right. Thank you so much, Dr. Ratan. Our time here has come to an end already. And so I just want to recap for those who didn't get to hear or listen to us today, to the full program. We were talking about World Population Day, which is observed on July 11th, and it is a time where we reflect and we spread awareness on the issues related to population, overpopulation, and anything related to that. And we would on the occasion we would share on issues such as health issues such as family planning, infertility, and sexual and reproductive health, which Dr. Umada Ratan from the Ministry of Health Women's Health Unit and Dr. Tamika Luncheon was joining us today and talking about that. For those who tune in, I am so grateful for you for listening, and hope that you've learned something and it would help you in terms of protecting yourself or or increasing your fertility rate, or in terms of helping you to be more wise in terms of family planning. So until next time, just be safe and be good to yourself, and thank you for joining us.